When cancer or some disease process hits a family, or friends, you look at it differently, and it's personal. But we should have that same connection with patients that aren't our family members. And as a surgeon, there's a bond with the patient. I really feel that. And certainly, we don't see patients for decades. Usually it's surgery. I see somebody, patient in the clinic, 4 weeks later we operate, come back 4 weeks, 6 weeks later, make sure you've recovered, and that's kind of it. And I send them back to their local urologist from around the Midwest or wherever they're from. But I think my experience with cancer, it's more than just doing surgery. It's connecting and doing what's right. And sometimes what's right is difficult. Medicine is personal. And surgery, how more invasive and personal can you get? And you got to remember that. When I was in Indiana, the patient came back a month later, was going to go to hospice. Well, I left early on Christmas, drive back, because we had that bond. And it was a 3.5-hour drive, but it meant a lot to them. And it meant a lot to me, because they wanted their surgeon there. I wasn't doing anything. They were in the ICU, they were very sick, and it was just a bad cancer. And you can fight, but sometimes we lose. But let's fight. And sometimes what's hard is knowing when not to fight. And she was at that point. Well, I needed to be there. I think taking care of patients, it's a fluid process. And one is, you see them in the office, I have cancer, it's overwhelming. Get them comfortable, get them, okay, I'm going into the OR, or I'm going with this treatment strategy, and I feel good about it because I understand. That's important. Telling them exactly, full disclosure, and telling patients what I've learned, this is what you're going to expect. No surprises. Let's don't have surprises. Now, complications happen, surprises happen, but, surgery's going to take this long. You're going to be in the ICU for 1 day. You're going to have a tube in your nose for 12 hours. You're going to be in the hospital for 6 days. You're going to lose, and I tell you, you will lose. Let's say you take out somebody's bladder. Doctors are funny. It's something's either 2 weeks or 6 weeks. There's always these old times, and we're kind of made up a little bit. But with bladder cancer, I tell patients it's a big. You take out their bladder. You have to do bowel work. I tell them it may be 2 or 3 months before you're back on your feet. And I typically say you will lose 15, 20 pounds. And you will have a day 4 weeks from now, and you say, I've healed, I'm recovered, I've done everything that day. And I said, but the next day you'll be out. And I said, you will have more and more good days and less bad days. And I tell the family this for bladder cancer. You will come in 6 weeks, you may be in a wheelchair. Not that you can't walk, just you're so weak from getting out of the car. And it seems like every hospital in the country undergoes construction. And we certainly have it here, but we had it. And I say, you will come in and you will be weak. And you will say, I wish I never had the surgery. I said, you may not say that, but I'm being honest. I've had patients say that, even though they're cured. But give them another 6 weeks and they'll get back. People get depressed. But if you tell them all that, you're like, well, hey, Steve was right. This is, or the family said, well, remember, Steve or Dr. Beck said, you're going to have those days that you're not going to do very well, or you're going to lose weight. And that's exactly right. But you will bounce back. So I think that just really, patient education in every process on the pathology, on their expectation intraoperatively, as well as postoperatively, I think that's the goal. That's the way to get people you got to be mentally ready for the surgery and mentally ready or prepared for post-op. And post-op isn't discharge day 7, see you later. It's a whole process after that they have to recover from. So the more knowledge the family has and we have to provide them, the better it is.